Arizona State Representative Matt Gress introducing a bill that would make several key changes to Arizona law and policies surrounding homeless solutions. We've been talking about that this morning, and Representative Gress was nice enough to get on the horn with us and help go over this bill with us. Representative Gress, pleasure to have you on the program. We opened the entire segment talking about the zone and how that was broken up. Do you feel, Representative Gress, do you feel like the zone is does like spread people around is the way it feels now?
Well, good afternoon. And I think that is what has happened, is that you've kind of dispersed the tragedy and misery that people living out on the streets are experiencing. And I think it's actually making it a little bit more difficult to get your arms around the situation. There are people who have started to create encampments in North Scottsdale on state trust land. You've seen people start, putting tents along the canals or around, bridges or overpasses or on ramps or off ramps. And that's exactly the opposite of what we should be doing when it comes to getting the help that these individuals need.
We outlined your 6-point plan that you have here with HB 2782. Why'd you propose what you proposed here? Like, can you give us a few sentences on what led up to all of this for you?
Constituents in my district reached out to me last summer in response to what the city of Scottsdale was doing at a hotel that was open to the general public. They were reserving 10 rooms to house individuals who are homeless, people living in the zone, and foreign nationals who would have otherwise been deported under the now expired Title 42. And so I started to dig in and talk to the city of Scottsdale and just became very concerned that this program was not helping people. It was warehousing people and not getting the help that they need and deserve. So I've had a number of different meetings and stakeholder meetings. We had something in September where hundreds of people showed up to get a better sense of what we should be doing when it comes to helping people who are homeless. And it really all circles around accountability for the cities and towns, accountability for the social service providers that these cities and towns work with, and also accountability for the people who are living on the streets. That there are expectations around, getting sober or, looking for a job or finishing your education. We need to step up and meet these individuals, but we can't make excuses and allow people to continue to live in tragedy and misery. It's unacceptable.
One thing that Chris and I keep coming back to, though, is what do you do with the multitude of people out there who don't want to get help or are so addicted that they don't know that they even need help, Representative Gress?
That is certainly a challenge, and
I think that puts it mildly.
It is. Last summer, Arizonans were polled on top issues of concern to them, and nearly 80% of Arizonans said that homelessness is bad and it's getting worse. And when you look at the root causes, these same Arizona voters said mental illness, substance abuse, addiction, and housing. But substance abuse and mental illness comprise the majority of why people think those who are living on the streets are in their condition. And I've always said that living on the streets is a symptom of other major problems, trauma in their lives, and addiction is one of them. You have to couple social services with law enforcement. There must be consequences that come along with doing drugs. It's illegal. So let's try to find you help through the community courts, diversion programs, but to just let people stay where they are, living outdoors, doing drugs like what we saw in the zone is a recipe for disaster.
Are there places still, Representative Gress, are there still facilities that are allowing drug use in the open? Because we were having trouble trying to think of one that would allow people to openly use drugs in front of them.
A few weeks ago, the subcommittee I chair discussed the sober living home fiasco, a $2 billion fraudulent organized scheme where essentially it disproportionately impacted the Native American communities, where they were housing people, billing Medicaid for lots of money and not providing any services. The Department of Health Services, which regulates sober living homes, gave testimony and showed us pictures of beer and other drug paraphernalia and drugs just out in the open in these common areas. There are bad actors out there in these spaces who purport to try to help people suffering from addiction or mental illness. This legislation is going to hold those individuals who have any formal or informal policies of drug use accountable.
As far as you know, is there any place that has a formal policy that allows for drug use? Is what you're giving me are examples of places that we know are bad actors anyway, that weren't providing services and they were letting people do whatever they want. I guess in my mind, I'm thinking of some of the great services that are down by the zone or
the Human Services campus downtown.
That as far as I know, they're not allowing that. So, I mean, are you basically proposing, listen, if you are defrauding Medicaid and you're allowing for these things, then things are going to be worse? Or is it a rampant problem that's happening in other places that we just don't know about?
Well, it's certainly happening within the sober living space. And we have heard reports from the provider community that there are spaces that either turn the other way, look the other way, and allow drug usage to occur. Some have masked this in the form of harm reduction. You've seen these kinds of policies go in very terrible directions in San Francisco, for instance, where people were being provided kits, harm reduction kits that included a crack pipe and some other things. And after they realized that was a terrible idea, of course, they started to roll back some of these really egregious and ridiculous policies. All we're saying is this is common sense. If you're a provider and you're helping those who are homeless, you cannot have any policies, formally or informally, that permit drug use on campus.
It's pretty common sense.
Absolutely not.
Are those places not liable for charges currently? I mean, your bill says, listen, if you're allowing it, then you're going to be liable for charges. Are they not currently liable? Because that seems like an oversight, in my opinion.
No, they're not. And
wow.
This population being served is a very challenging population to serve. Yeah. And people are going to have relapses. There are going to be situations where people come into the facility and they are high, they're clearly under the influence, and you don't want to just say you can't come in here, because that's kind of counterintuitive. You want to try to wrap your arms around them, give them the support and the healing that they need. But at the same time, you can't allow someone who is actively going in and out and in and out. If you have a resident who's coming in and out 15 times a day, something's up. Something's not right. Having a handle on people coming in and dealing drugs to a very vulnerable population, we have to put an end to it, and there need to be policies against it. That's one of the reasons why this bill, one of the central pieces, is that we're going to establish drug-free zones in these areas where people who are homeless are served, similar to the school drug-free zones. And they work. We've seen, drug sales, drug usage, all of that significantly be curtailed when we started seeing the school drug-free zones back in the 1980s. This is an important step forward to protect a vulnerable population.
Wanted to thank Arizona State Representative Matt Gress for joining us today. Representative, it's been a pleasure talking with you. I look forward to the next opportunity that we have, and hopefully your bill gets some good conversation moving, and we see this move through the legislature. Thank you so much for your time, sir.
Of course. Thanks for having me.
All right. Very good.
Thanks for watching The Chris and Joe Show. Click to see more from Chris and Joe, and tap the button in the middle to subscribe to KTAR News.